and public health expertise. He holds a fellowship certification in adult psychiatry from the National Postgraduate Medical College of Nigeria, a master's in psychotherapeutic studies from Middlesex University, UK, and multiple certifications in cognitive behavioral therapy, conflict response, addiction prevention, and humanitarian aid. His professional journey includes leadership roles at the Federal Neuropsychiatric Hospital, Kaduna, where he served as Director of Clinical Services, Head of Forensic Psychiatry, Pioneer slash Head of Medical Psychotherapy, and Coordinator of Residency Training. He has contributed significantly to psychiatry education by teaching medical students and resident doctors, supervising postgraduate theses, and participating in curriculum development. Dr. Abiola is an active researcher with numerous publications in national and international journals, focusing on topics such as addiction prevention, mental health, and resilience. In addition to his academic contributions, he is involved in community service, offering mental health workshops, addiction prevention training, and delivering public lectures on addiction and youth health. His achievements have earned him commendations and awards, reflecting his dedication to advancing psychiatric care and education in Nigeria. Dr. Abiola is currently a psychiatrist at Data Unit. So, DATA is an acronym for Drug Addiction Treatment Education and Rehabilitation, Department of Behavioral Science at the University of Ilorin Teaching Hospital. Distinguished ladies and gentlemen, you already know how we do it here, right? You can't clap this way so we can have decorum on the group, but please use the chat feature. Let's drop a round of applause for Dr. Abiola. If you can hear me, sir, good morning and thank you so much for joining us today. In case you're speaking, sir, your microphone is muted. If you can hear me, say hello to
Oh,
us.
hello, thank you for having me, and it's an honor to be here with all of us. Thank
Thank
you
you
very
so
much.
Thank you so much for joining us. You know, it's a beautiful Saturday, and you could have been at an Owambe, trust me. But I can tell that this is something you're very passionate about, and we do not take your time for granted. So really, thank you for joining us. So let's go straight into the conversation for today. We're talking breaking the chain, how substance abuse is stealing youthful dreams. Before I talk about, or before I even like to ask you, the question around how you think substance abuse is stealing youthful dreams, I'd like to first ask you, what is drug addiction, and should it be considered a health problem?
Thank you very much for asking the question. I may try to open the horizon a bit so that we can look at addiction in a more bigger perspective. While the topic says drug addiction, but addiction comprises not only of substances that are being abused, but also comprises of behaviors that people also abuse. So that's why we have disorders due to use of substance or behavioral addiction. So the substances can vary from what we know, which is common in the society, like alcohol, cigarettes, cannabis, that people might be aware of, or use of some other prescribed medication that are common in the community that people abuse now, the use of trauma, things like that people do. And they can go to behavioral problems, so like gambling addiction, like gaming addictions, like pornographic addictions. So so that's why it's encompassing. And what is trying to say in a simple word, not using our technical jargons, is that when somebody engage with the substance or the process, and that is abusing the brain of the person. So by abusing the brain of the person, it means that it is causing injuries to the brain of the person. And we have many evidence to show that. There are what we call functional imaging that shows what the brain of people who don't use substances or engage in such processes compared to LD people. And when they compare the two, people that are engaging and using, and people who don't, we find that there are many wounds in the brain of people who are engaging and using substance of abuse, or engaging with such addictive processes. So, and that makes it the trouble with addiction. Of course, there are many other qualifiers that we may look at. But however, our current understanding have make us to know, even if somebody engage with it once, some level of damage is done. So the individual might be lucky to recover faster if you stop using. But if the individual continue to use them, the damage continues to go on. So the wound continues to deepen. And because the wound is an eating wound, because it's a wound in the brain, and the brain is so jealously protected. If you look at our head, we have the air, we have the skin, we have layers under the skin, we have some other fluid that are spread there, we have the bone. Then under the bone, we have some other layers and fluid that are there, and we have fluid also inside it to protect the brain, to show how important the brain is. So whatever we do and we take to go and destroy that brain, that we need to be productive, to be useful, to be even be recognized as a full functional individual in the community or even to oneself, then that is what addiction it robs one of that, it destroys that.
Mm. Thank you so much for speaking to addiction very broadly. Now, streamlining it to the conversation that we're having today, which is about drug addiction. Can you also take us through that? And would you say that drug addiction is a health problem?
Yeah, like what the founder have even mentioned from the beginning, and from your recanting of what the World Drug Report have said. It's not just only an epidemic, it's a pandemic. It is globally widespread. And many other nations are taking many strong strides to see that they can reverse this trend, to see that people don't continue to become enslaved to this problem, because it's a very troublesome problem that enslave the person that engages with it or that use it. So because it's enslaved them, so it's a big problem. And the statistics is very frightening. And the statistics also continue to show it keeps increasing. So, and those are the frightening aspect of it. It's not just always there, but it keeps increasing. And one of the results we have in Nigeria have shown that uh, more than, at least it ranges depending on the kind of substance that we may talk about. It can range from as low as 1% to as high as 40 or even 60% in some instances. If you are talking of the commonly available substances like alcohol, cigarettes, it can be as high as 40 to 60%. If you are talking
Mm,
of those illegal drugs that people use, then depending on the availability of it, the accessibility of it, and the
mhm,
affordability of it, that determine the range. So
mm,
that's why that it's a very problematic situation that we have, not only in this country, but also outside the country. And the privilege is increasing because the addiction industry are investing more in
mm,
advertisements, in
mm,
telling more lies, in bringing more myths to describe what addiction is not as what
mm,
it is. For instance,
mm,
one of the myths that we used to hear is about a glass of wine is good for the heart. But
mm,
that is a myth. It is not based in any scientific evidence.
mm,
And there will be publications that have come to incontrovertibly show that this is a myth.
mhm,
No amount of alcohol is safe for health. And
mm,
research has even come to show that the most dangerous of all drug of abuse is alcohol.
mm,
So, and that is widely available, not to talk of the one that were prohibited and people are pushing and canvassing for their legalization. So, all this comes to show us that these are very troublesome uh, things to be made, to be allowed to be present in the community. Because
mm,
once they're here, the people that use it are become the victim, they become the commodity for the industry. The addiction industry turn people to their commodity and they make money on it. And because the
mm,
addiction addictions are cheap to produce, they make a lot of profit from it. And that's why they have a lot to throw around in sponsoring youth related programs. You see that they're doing sponsoring sports. You see their adverts always featuring on this because it's strategic to keep targeting the youth. And
mm,
so those are some of the troubles there. And that is why linking it to what we are talking about.
mm.
And I know, like you said, we have a lot to cover. So
Absolutely, absolutely, we do, and we're just barely scratching the surface right now. And I really like that you pointed on the addiction industry and how they're super heavy on marketing. Even on cigarettes, you would see smokers are liable to die young. But despite that, a lot of people overlook that because the addiction industry, like you talked about, they are putting so much money talking about what addiction is not versus what addiction is. So I really like that. But now speaking on addiction as well, sometimes people think that well, as far as I'm not using cocaine or I'm not using marijuana or all of these hard drugs, well, I can't really say that I'm addicted to this thing. So what do you say are the small, seemingly harmless steps that often lead young people into substance abuse? What are those things that you can start doing as a young person that can ultimately lead you to becoming a drug addict?
Oh, thank you very much for that. Uh, there, like you said, because of the myths, it is usually, typically spread around that it's a way to relax. That if you are stressed, you want to relax, you need this. If you want to overcome loneliness or isolation, you need this. That if somebody felt that you should cut fun, he needs this. If people even go to social engagements, it is mysterious that they make people to believe that if these substances are not present there, then that's not making the occasion worth it. That's so they are, so they, we call it like social facilitators, that they
Mm,
create and they weave it to make it look as if they are culturally relevant in order to bring their occasion to the standard that everybody will clap and say, oh, this is a wow, okay, the occasion. So those troubles are there, and with all these mixed messages or mixed messages and wrong messages that have been sent around, the signal gets to the youth, and that causes a lot of trouble. Some research have been done to show some of all those things that contributed to it. For instance, it is found that when a child who watch a lot of television, which is even worse today with the social media, is that they are the one that have advertised a lot more on those social media. And they, because the age group of the person interacting with is there, they targeted them specifically also.
mm,
They also have social influencers who are used to target them in the place to advertise all these substance of abuse. So those adverts make it available, make it bring it to the consciousness and the awareness of these youths that this is available. And by looking at those misnomer, they may think that, oh, this social influencer or the person they show in the advert, that's where I might look like. So they bring modeling to confuse people. They show a person who is healthy and they bring a poison and they bring the two together to make it look as if it's the poison that is sustaining and bring about the healthiness of this individual. And I'm sure we can see the picture they call the Marlboro man. We can see a cowboy who is athletic, but we all know when people take substance of abuse, it doesn't do that for them. It doesn't make them to be all that they show. Like sometimes the alcohol industry too, they created their own. So they keep creating all this misinformation, and this information misled you to think that, oh, in order for me to be athletic or to be successful, to look successful, to have that aura of being somebody important, or to say, okay, I've arrived, I'm an emerging youth, and I'm such youth of now. That misinformation gets to them, and in trying to embrace it, they get derailed from there. They also might get engaged with poor peer pressure. Peer pressure is not the problem, but when they are poor, when they are negative, that's where the problem. Because they are good peer pressure that we should encourage and we should allow people to go there because they don't use substance. They encourage morality. They encourage healthy lifestyles. These are good peer pressure, but there are bad negative peer pressure that people go and those are the ones often promoted, and those social facilitation also come in that way, and to think that, oh, because I'm a youth, and if I don't use like all these people that I know that are using substance, it means I don't behave like a youth, it means I'm behaving like an old man. Or so, and that is not true. There are many youths that are not using substance. Research have shown majority of the people in the world are not using substance.
Mm.
However, the addiction industry are doing a lot to make it look at a lot of people who are using it. So those wrong inform messages that have been sent further confuse the youth and make them believe that, oh, if must belong, I have to use, I have to follow the negative peer pressure. So this, and also the concept of experimentation. Let me just try it and see what it will happen. People have been saying it's bad, try it. But for those that get their first use based on their nature, experience the worst experience from it, they run away from it. But for
Mm.
those that maybe what they use is not strong enough, or that they may feel, okay, well, I get some bad experience, but I will continue to use, because if I don't use
Mm.
it, I will not belong to this group.
Mm.
And those pressures are there. Some people will feel that, oh, I need to wow this lecturer. I need to be able to be bold to speak in front of the class. I need it. So some of those anxiety that the youth might go through, they also use substance to treat it. Also in the age of social media, where things, Instagram that were created that make people to look unsatisfied with their looks. When they take their picture, they send it there, they become unsatisfied with their look. That also put pressure on them, and that pressure make them to become addicted to the social media, because it
Mm.
exploits the emotion of insecurity, and by exploiting their emotion of insecurity, they become addicted to keep taking their picture in so many places and keep posting, and they don't get the required satisfaction they thought they need from it. And when
Mm.
that was in, it also serves as a gateway drug like cigarettes for people to start using other drugs, because they are not getting the
Mm.
satisfaction and they're addicted to use to posting their images there, and that also contributes. So some of these play role in why the youth can be misled or can be confused to think that this is a way to adopt. And one of the last thing I would just want to mention on this is that people may think that it's a coping mechanism, but it's a very bad coping mechanism. Because when people have
Mm.
stress, they use it to try to cope. And like one of my patients once told me that when I drink alcohol, it just put a pause on my problem.
Mm.
That when I finish coming out of the trouble of the effect of the drinking and all the that it has caused, then that problem go to play and it continues. So these are some of these things that rally around the idea in terms of why you use substance or otherwise, and why they might be enticed to it.
Absolutely, Doctor. You've touched on a number of things, and I think we would all need to unpack it even after this session. The need for young people to belong, how social media is also playing its role. And, the very last thing that you talked about, which is about people trying to look for a temporary escape out of their problems. But what some young people, or maybe what many of them may not know, is even after that period, you will still come back to that problem. And the bad thing is you're also causing some debilitating problems to your health. Because imagine that you take alcohol, for example, or you're smoking because you want to get out of a problem. After about, say, few hours, the problem comes back, it continues. And before you know what is happening, you become addicted. Doctors are telling you that you now have maybe like a lung issue or you have cancer, or whatever the case might be. So it is important for young people that when we look about social media, when we think of role models, we need to look at the positive ones and not the negative ones. Because trust me, all of these are just for temporary pleasure. They are for temporary enjoyment, like some people like to call it. But in the long run, you're doing so much to yourself. And it's not just to yourself now, it's also to the people around you. Because imagine that you have a health concern, it's not just your problem. Your family members are rallying around, asking people on social media to help you with the challenge you're facing. So really, doctor, thank you so much for mentioning that. I'm sure we'll still come back to talking young people, social media, and what have you. But right about now, you've worked with a lot of young people, especially those who suffer from drug addiction. So I'd like to ask you, what do you think are the most devastating ways in which substance abuse has robbed these young minds that you've worked with of their dreams?
Thank you very much. Usually, when people present for drug use problem, we look at it that they have what we call multiple brain problems.
Hmm.
One problem is the drug itself is causing damage to the brain. The other problem that is causing other problems that are also damaging the brain more. So that's why they have multiple double, what they call the dual brain problem. So it may not only be the drug problem. So often people don't present with the drug problem.
Mm,
Often people usually often at times even present because of the other problems that it might cause. So that is why it is so devastating that the drug itself is causing the damage to the brain, which is reducing the potential of the youth, because without the brain, the youth cannot perform effectively. Its potential is being stolen away by the drug. So the drug is reducing the capacity of the youth's brain in order to be able to perform and fulfill the expected roles and the tasks it needs to do. And the task usually set for the youth is that it looks at life usually in two phases. I need to get to this phase either by education or by vocation course. I graduate, I do freedom ceremony or things like that. Then I start my next life phase of life, which is to now build a career from it, get settled, and live on. So the for the youth to even lead that first phase of life, the substance devastates that aspect of first phase of life. So it destroyed the ability to learn, it destroyed the ability to participate in vocation training or in academic activities. And once that is destroyed, then it robs them of that future they are looking towards. towards. In secondly, it also robs them of their health, because like I've said, that it's the addiction itself is causing is a health problem, and now it causes other multiple other problems. It can cause maybe other mental health problems for the individual, like depression, anxiety, psychosis. It can cause it and many others like that. It can cause physical health problems too for people. Because of substance, people have developed diabetes, some have become hypertensive, skin diseases, skin cancers, body cancers. So it can cause many other health problems too. It has also been found that it can cause uh, what I may call spiritual problems too. That people might not look at that angle, but it does cause spiritual problem because it causes what they call
mm,
spiritual distress, which is one of those
mm,
spiritual diseases that people can have. And it robs them of that. And once it robs them of that, it further complicates their lives, that they may get to that stage of spiritual nihilism, where they may say, God doesn't exist, that I'm
mm,
suffering and nobody is there to help me overcome this suffering. So that trouble can be there. Apart from health problem, it's also called legal troubles for them, because the authority, these are banned substances. So they have problems at home that they may need to bring the people, that's the enforcement officer, to come and engage with them, or somebody in the community, they might attack somebody in the community, spoil something in the community, or even go directly to destroy things that the communities are enjoying. So they have a lot of legal problems. They
mm,
their problem is endless. And most importantly is that they keep depleting the little resources that's available for them, for their family, for the community too, because the community will keep spending a lot more to get people to come and arrest them, to see that they can face the music of the crime they've caused. So
mm,
all this contributed to how it can devastate the life of the youth in so many ways.
mm. Thank you so much, Doctor. Before I go on to the next question, I can see that a number of hands are raised. Later on in the conversation, you would get the opportunity to ask your questions. So make sure you stay till the very end. And I can also see that we have more people who have joined us. This is very impressive. So, in case you just joined us and you're wondering what is happening, this is the last health talk series for the year 2024, put together by Sakina Medical Outreach. And we've been engaging our specialist for today, Dr. Tajudeen Abiola. The topic for this conversation is breaking the chain, how substance abuse is stealing youthful dreams. Dr. Abiola has been so gracious sharing with us, from what addiction is generally to streamlining it to drug addiction, telling us how social media and the addiction industry, are contributing to making this more popular, especially among young people, not just in Nigeria, but across the world. So So, doctor, my next question to you is, we've talked about a number of things: addiction, how social media is influencing young people negatively for the most part, how young people want to feel, how they want to belong to the community, and as a result, they are taking drugs and what have you. But let's talk about people who are suffering from drug addiction at the moment. How do you encourage them to get out of drug addiction? Because we know that when you are addicted to something, it's very, very hard, almost impossible for you to get out of it. So if there is somebody on this call, or there's somebody on this call who knows somebody who is suffering from drug addiction, what do you tell that person? How do they get out of it?
Thank you very much. That's a very good one, and that is why we'll thank the government, because despite many things we blame them for, they still make the effort to create hospitals, and they also try to see that in every hospital there are Department of Mental Health or Department of Psychiatry or Behavioral Sciences. That's every federal government hospital and some state hospital that are the capacity of a teaching hospital. They have that, and there are some standalone mental health hospitals, psychiatric hospitals. You have 8 across the whole nation. So we have them, and there they have units that manage problem of substance abuse. So which shows that when somebody does have this problem, then you should have hope. You should not lose hope that no, there's no way out for me. I've tried on my own. The problem with addiction is that we usually call it a chronic relapsing problem. Chronic means that it's a long time, and relapsing it to keep reoccurring. So when people try to stop on their own, they will sleep again because it's so difficult. That's why it's enslaving the people that are out there. And because of this, it makes it difficult for them to be able to succeed on their own. Or even with support of some family member, it can be difficult. But when we all work together and you get to professionals to work together on this, it becomes easier to do. And that's why the treatment is not one of those that we just treat just haphazardly like other. It is treated like every other long-term problem. If somebody is having hypertension, the treatment is likely for life. If somebody is having diabetes, it might follow that pattern. So similarly to it might go, but when it comes to addiction, the treatment might follow that pattern, that it's likely that it might be for life. But however, the most critical period that will help the person is when the person come into a drug rehabilitation center. I'm not talking of any of those charlatan places. I'm not talking of those opened by just anyhow individuals. I'm talking of those that I can be sure what they're doing. And that's why I've mentioned those government hospitals where the professionals are there, where the other health providers are also available to contribute, because treating people with substance abuse, like we say, they have multiple problems. They don't usually have one brain problem. They have multiple brain problems. They might also have physical health problem. So where the multi-specialists are there, it's easier to treat them there and get every other specialist that's needed to contribute to the management of these individuals. So there is hope for them. They should not lose hope, and they should ensure that they keep up the struggle, because the journey towards overcoming addiction just starts with taking the first step. Let me take the first step to the right place. I think the people who are addicted might be so defeated. They are at the rock bottom and they've lost hope. So their family members will rise for them. They would not lose hope too. The family members should not feel that we have tried our best. We have been to so many places and yet we did not get help. Every place we have spent everything that we have known. Go to the right place and you see that the pattern of treatment is different. And people are not going to be giving you wrong information and be giving you false hope, because most of the places people do go to are false hope. And those misinformation, like I said, may call it a spiritual problem when this is a medical problem. And because it's not a spiritual problem, you are looking for a spiritual solution, then the person will not get well. So the person is not having a spiritual problem. But when the person is having a medical and you look for a medical solution, then the person should get well and get some improvement and be able to put his life together and move forward. So all this go around it and help us to see that this is that there's hope for such people, and addiction can be overcome because there are many success stories. There are many success
Mm.
stories about people who
Yeah,
recover
Doctor.
from it. Yes.
Yeah, speaking of success stories, you're gonna share a success story with us, very soon. But I just want to say that people who suffer from drug addiction, they need our help, they need our support, they need our compassion because there should be hope for these people. And also to mention that language usage is important because already these people are stigmatized against. So you don't want to say this person is a drug addict, right?
Yeah.
Importantly, maybe say this person is suffering from drug addiction. Because, like Doctor said earlier, drug addiction is a health challenge. So, please, if you're on this call, you suffer from drug addiction, or you know somebody who does, also begin to help them with the way you call these things on them. So they are not drug addicts. They only suffer from drug addiction and they can always get support. They can become better and they can become resourceful persons for our society. I'd like to say that this is a public platform, and while we appreciate those who have turned on their cameras, if you know that you're not in a good position to turn on your cameras, please turn off your camera because this is recorded and you wouldn't want a situation whereby this is played later and you're not looking good in it. So please, if you know that you're not in a good position to turn on your camera, by all means turn it off. We're happy to have you turn off your camera. If you're not in a good place, like I said before, please do not turn off your camera. I can also already see more hands up. I would ask Doctor this very last question so that we can entertain more questions from people who are joining us live at this time. So, Doctor, you spoke about success stories earlier, and I believe that stories are powerful. So, maybe there's somebody on this call or somebody that would watch this much later thinking to themselves, well, everything Doctor is saying is just in the books. I mean, this has happened to a number of persons that I know, and they did not come out strong at the end of the day. So, Doctor, please tell us a success story, somebody you've worked with before, or somebody that your colleague has worked with before. They suffered from drug addiction and they are now useful to themselves and the society.
Thank you very much. Of course, there are many success stories, and there are also those that we are still working together so that they can overcome that. There are many of them, but one of the things that is often there is that I think for some people that I've come across is that they started using because they go through trauma. Something happened to them, some fail exam, some were raped, some there are robbery incident upon them, and some, of course, due to the peer negative peer influence. But however, some are more unique than others. Sorry, please. I remember one of such who has a sickle cell disease, and he has gotten treatment over and over. That it has led to a big problem relationship between him and his family member. He has been a nuisance in the community, and but one of the last time he came, he was almost dying. He doesn't have enough blood in his system. There was doctor strike at that time. Nobody to be able. So it was a very challenging period. But we rally around. We come together to work together with him and getting the right people to assist us, because like I said, multidisciplinary, we have to get other people to come and do a cut down. We couldn't get vein because every part of his body is collapsed. So they have to do some procedure in order to be able so that we can transfuse him. That is possible. But as all this are being done, other things are also going on. So the multidisciplinary setting, we have the mental health, especially the psychiatrists there who are working with him. We have the family physician who is working there. We have the medical social worker who are doing their part. We have the psychologists who are working there. But at the end of the day, one of the things that is so unique in this aspect that this particular time, the person got what he needs. He felt that this is the first time that he has a different view about what the treatment is. He has a better understanding about what the treatment is, and is willing to take the right step. And for this individual, Then it started slowly, that right from the treatment, that his motivation become much better. Motivation for us is not a yes or no question. So because when people want to say, I say, are you motivated? No, we look at the individual through a cycle. So, and the cycle, we look at it as having 5 stages. And based on the stages, then that would determine many other things that we will do. And based for this individual, we find that he has gone through all the stages and is there at that stage that is ready to take action, ready to prepare to take the necessary step. And we're able to help him walk the step. He passed from not considering treatment, he considered treatment now, and now he has decided that he will meet it, and we're helping him to maintain it. We are still in communication because the treatment is continuous. Like I said, he doesn't need to be coming to hospital, he's not on admission, but he does give feedback about the challenges that still come. Now he has getting his life back, he has married, he has settled down, he got a job, and he's able to live his life independent from his parents. Oh, he has to
Mm.
live on family because he has caused a lot of trouble everywhere and there. He has to live on family. And we will not blame him much for why did he become an addict. Of course, he's a sickler. He will need some treatment to overcome that pain that is associated with the illness. And in the process, he got troubled with it, which shouldn't be. Of course, that do happen along the line, but
Mm.
that shouldn't be, because of course managing people like that should also be multidisciplinary, which is now the practice. So see that every other specialty comes together so that they can keep assessing the multiple landmines on the way, so that this
Mm.
that can be able to differentiate between going through his pain of illness and just trying to get high. So
Mm.
ability to manage that area is very helpful to help. But
Mm.
however, it's one of the major success story because it was either he dies from that admission or he survive. And maybe that near death experience. He has had many near death experience before in the past,
Wow.
but this is unique. And we are fortunate. And if I may summarize what I felt that helped him, that we're able to help him build, is that one, he has a very good support. Okay.
Mm.
For somebody to recover, you need a good social support network. Also, he was able to define what his purpose are. All along, he never knew what his purpose is. But now he
Mm.
was able to get, okay, this is my purpose in life. This is, I need to live my purpose in life now. Was able to define that. We're able to help him through the treatment to improve his resilience. And his resilience help him to overcome the multiple relapses that he has and the setback I get in the past, and help him to realize that I need to forge on. There will always be temptation, which at times we can look at addiction that way. And when there are temptation, what I do? We delay gratification. So his
Mm.
resilience build so that he can delay gratification. So that instead of jumping to it, he delayed trying to do that. And that helped him to get over the cravings. And that make him not to go and do it. So all this work
Mm.
together. And in the process, we're also helping to say that, yeah, you keep growing. So personal growth keep coming for him. And that help him to be able to get over this. So those success
Mm.
stories are there, and there are many. I can recount so many. I have one that I've came with
Honestly,
the
I know,
appreciated and
especially especially given your wealth of experience, you have so many things to share, and I really just want to say thank you for the important work that you do. You know, it's not easy. Sometimes I look at doctors and I'm like, okay, okay, it's so much work, it's so much commitment, it's so much dedication because this is a life that you have saved. Really, thank you so much for the valuable work you do. We cannot pay you for all the work you do. It is priceless. Thank you so much. And I
thank
really
you.
like that you use the example of the sickle cell person, because I also have a question here that's about sickle cell. And the person is asking the strategies that can be deployed to reduce the dependency on prescription drugs.
Okay, thank
Again,
you
I'm
very
sorry,
much.
sorry, doctor. Before you go ahead with your question, with the response, please, I just want to also crave our indulgence yet again. If you're not speaking, mute your microphone. If you're not in a good place to turn on your camera, please do not turn on your camera. So, doctor, please go ahead with your response, but please keep it really short because we want to take a few questions from our listeners here.
What the summary is that we should have a comprehensive pain management for them. And pain management is not only through medications. there are many other modalities of pain management which the person will get while the person presents to the managing team. So the primary managers are there, there are physicians, there are hematologists, then that they will do their bit. Then there may be psychological pain that the person will need to work with people in the mental health phase. Then there are other aspects of pain that the person might benefit more from working with a physiotherapist. So so the modalities of management of pain is wider and is comprehensive. So trying to use only one modality to manage pain can be the trouble at times. So having that comprehensive pain management plan is very, and it also be great for any hospital who manage people like this, maybe to have a policy on pain management. Because often when there is a policy on doing things, it helps to flag out earlier when somebody has started becoming dependent on it. Because it gives what to do, what not to do, what to look for, and what are the missing things that if you don't find them, then these are telltale signs that there are troubles. So for every managing place, it should be good so that they have a policy on management. And also, it will be grateful that after doing all this, there should be advocacy on that when you have this is not the way to manage it. This is the way to manage it. This is what he needs to do. Of course, there are people who are sicklers, like the question is, when they are not in crisis, but because of the addiction, they will feign crisis. So and that's why a policy we have to know this time is failing, and this is the way to manage it. This time is actual crisis, and this is what to do. So all those things work together. So without that comprehensive management plan, without a policy, it makes it very difficult to be able to overcome this. I hope by embracing at least these two facets, there are more, by embracing this will help to be able to guide better.
Yeah, thank you so much, Doctor. I think one major thing that I've gotten from this particular response is there are multiple layers of support needed to manage these things. So you don't just go to one person and say, oh, one person solves it all, right? So if you're either you're suffering from drug addiction, or you're a sickler, or you're on the spectrum, or whatever the case might be, please ensure to speak to multiple professionals. It is very important. Before I give few persons the opportunity to ask questions, because we're running behind schedule at this time, I'd like to quickly acknowledge some distinguished persons in our midst today. In no particular order, I'm starting with Professor Nasir Abdul Rashid. He is the Director of Operations for the Sakina Medical Outreach. Thank you so much, sir, for joining us this morning. We also have welcome. We also have Mr. Disu Kamar, is the trustees for, of course, the Sakina Medical Outreach, and of course the chairman of MPAC. Thank you so much, sir, for joining us as well. Mr. Disu, sir, if you can hear me, just say hello to us.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much, my sister. Yes, it's nice to be here. Thank you very much.
Thank you, sir. Thank you for joining us. Thank you. We also have Alahada Rahmat Egbeyemi. She is a member of the Advisory Council for Sakina Medical Outreach. Salaam alaikum, ma'am. If you can hear us, say hello to us.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you for
doing a good job.
Thank you so much, ma'am. Thank you so much. And then the last but definitely not the least, I have Dr. Mrs. Oyewole. She is a member of the management team for Sakina Medical Outreach. If you can also hear us, ma'am, say hello to us, please. Okay, so maybe she will do that much later. But before we can ask questions now, I see a number of hands up, and I apologize in advance if I cannot take everybody. But I would want you to please look into the chat room. You can see that we have dropped a number of messages there, or there's a summary of what Dr. Tajudeen has been saying, and we also have a link to donate to our important cause. You can tell that we're doing a very, very important and worthy cause at the Sakina Medical Outreach, and these things are expensive. They come with a lot of money, so we need all the support that you can give to us. So please click on the link to donate. If you cannot donate yourself, copy the link, share with your WhatsApp status, all the groups that you belong to, and encourage them to also donate to our cause. Thank you so much for doing that. And also to mention that we are on social media. So if you want to stay up to date to all the fantastic work that we're doing, and if you want to learn how we can support you better, please ensure you're following us on social media. On Facebook, we are Sakina Medical Outreach. On YouTube, X, and Instagram, we are Sakina NGO at Sakina, spelled SAKINAHNGO, on YouTube, X, and Instagram. So really, thank you so much for following us and for engaging with our work, and importantly, for sharing the link to donate to our cause. Right about now, I'd like to call on Mr. Yunusa. Please unmute your microphone and ask your questions. Please keep it very, very short because we really do not have time, and you can give opportunities to others to also ask their questions. Mr. Yunusa, please unmute your microphone and ask your question. Okay, if Mr. Unisa is not there, can I ask? Okay, wa alaikum assalam. Please go ahead. Wa alaikum assalam. We can hear you. Please go ahead.
Why is it that there is a lot of stigma in our society, and how this stigmatization can be addressed? Doctor, I really appreciate your effort and the effort you put in order to address these mental health challenges in our society. How can this stigmatization can be solved, and what are the way forward?
Okay, can I get all the questions so that I can answer?
Yes, doctor. Yes, sir.
Questions so that...
Yes, go ahead, doctor. Or do you want to take multiple questions at a time?
Okay, if you want me to, I can go ahead.
Okay, so go ahead.
Yeah, like it describes stigma. Stigma is one of such phenomena that is limiting people to have access to treatment. So to address stigma, which we can classify to be that which people do to others, that's public stigma. And there's also can be looked at the one that the individual also do to himself. That's personal stigma. Because when people are sick and because it's moralized, people would not think that they need to go for treatment. And often that is why people will find it easier to say it's a spiritual problem, because they want to get it to allow them to get sympathy from people. But once they call it a spiritual problem, they will be looking for a spiritual solution that will not solve the problem, because this is a medical problem. So stigma works on that aspect of trying to work on the myths of labeling individuals who are having actual suffering and blaming them for why they're having the problem. And that also limits the people to have the courage to come forward to say, let me take the step towards solving my problem. So stigma works in that way. And there are many things in our community, in our society, that goes through this. One of it is lack of understanding of what that problem is. I know historically several hundred years ago, when malaria is a major killer disease. It's still a killer disease now, but not like in those days where it kills both children and adults and everybody, where there's no treatment for it. People used to think that malaria is caused by evil spirits in the swamp area, that's the swamp of the forest where mosquito thrive best. But people think there is the evil spirit there, that when you go there, the evil spirit will attack you, it will lead to that high fever and people die. So it's because of misinformation or lack of information about what it is that often make people to stigmatize. So that if people understand that this is a medical problem, it's a problem that affects the brain, and it's a problem that can be treated when you go to the right place, then that will reduce that stigma there. So calling it a spiritual problem is out of it. Understanding what it is the primary thing. And normalizing that, like we do for every other person that is sick. That when somebody has, we should normalize it. The person needs treatment. And the person too should not stigmatize himself to think that I'm weak if I have to stay here to get treatment. Often that also comes that if I have to stay this long to get treatment, then that means I'm weak. But that's not true. The problem is there. It has damaged the brain, and the brain needs time to heal. And without the person going through the treatment, those wounds, those that are in the brain, will not heal. And the individual will always be easier for the person to sleep. The temptation, the individual cannot wield any resilience against the temptations to abuse those substances, and the individual will continue to use it. So stigma is very paramount, but understanding that this is not a spiritual problem, this is not a moral problem, a mental health problem that affects the brain. And by understanding that way, then you need to take the individual, just like you take anybody that is go for treatment.
Okay.
Thank you very much.
All right. Thank you so much, Doctor. Miss Kainde, could you please mute your microphone? Could you please mute your microphone? All right. Thank you so much. Can I please have Miss C. Lokwe to also ask a question? Please keep it simple and short and straightforward. Miss Cecilia, if you can hear me, please unmute your microphone and ask your question. Okay, if Miss Cecilia is not available, can I please have Miss Tinu ask a question?
Yes, good morning.
Walaikum salam wa rahmatullahi wa barakatuh.
I'm a pharmacist. I'm a clinical pharmacist. My area of specialization is the mental health and emergency service. I work with one of the general hospitals in Lagos State. Yes, saying drug addiction, people might think that it's illiterate that go through the addiction. I can tell you categorically that medical experts go through a lot. But I have so many professionals that I handle myself. I have doctors, I have nurses, I have pharmacists that have gone through this way, and they are addicts too. Like Professor actually, the doctor said, people start thinking it's a spiritual problem. I have a friend that was actually addicted to some kind of pain reliever because she has colon cancer. So she was addicted to a particular type of opioid injection. You know, it got to a level that people start thinking that it's a spiritual problem. But I can tell you, it is not a spiritual problem, but it's a serious issue. But what we should do is that when we see them, we should not stigmatize them. No, we should not, because even the stigma can even kill them faster than the addiction. After I have a colleague, to a pharmacist colleague, he's a sickler. In short, he jabbed himself on injection to the level that he got impotent, and that actually broke his marriage, and he ended up in the psychiatric hospital at Yaba, and unfortunately we lost him. Yes, there are success stories and there are stories that are not palatable. I can tell you, some people after the addiction, after I've treated them for the addiction, they have to start going for burns and trauma clinics because most of the things that are injectable destroys them seriously. So they have to go from one level of care to another level of care. You know, some go as far as being dull. Those that are very brilliant become dull because it's actually most of these opioids works on the brain. So I actually appreciate this particular lecture, and I'm very sure that I feel so elated and happy that I'm here today to even listen to what you have to say, because I've been on it for years. I advocate it, and I don't mind if I can partner with you. Let's do things together. It's a serious menace to the society, and it's not about being an illiterate or not being in the medical. Most people in the medicals, they are victims of it. Because we have nurses, we have access to it, and we are the ones that actually get addicted. May Almighty Allah help those that are in need, because it's a shackle of burden and bondage. From one level to the other, from one ampoule to the second ampoule, before you know you are taking 15 ampoules. So please, let us do this together. Don't let us stigmatize them. Don't let us feel that, yes, as a person, I always look at you, you want to kill yourself. Why must you take that as a pan before sleep? But Yoruba used to say, Is when you are in it, that's when you know, or when somebody very close to you has that this is a real problem. But when you are looking at it from afar, like, now why do you want to kill yourself with sleeping pills? But until you are in it, that is when you know that it's a real life and problem and challenge.
Thank
The
you so
Almighty Allah
much.
all of us out.
Amin, Wayakum. Thank you so much for sharing, ma'am. We truly appreciate and what you spoke about partnering with us. We are open to more partnerships and collaborations. Please send us a message via DM on our social media platforms, and we'll be happy to take the conversation forward. Really, thank you so much. And I really like what you spoke on stigma. We need to stop stigmatizing these people. They're human beings like us. They need our love, they need our support, they need our empathy, and they need our compassion. So it's not a thing of who asked you to do it or why did you do it. It's about what can we do to help this person get out of that situation. So really, thank you so much, ma'am. We truly appreciate. I'm going to take a few more questions. Doctor, please, let's take multiple questions at a time before you respond to them, so we can better save time. Mr. Bolaji Kamiyu, if you can hear me, your hand is raised. Please unmute and ask your question. Okay, if Mr. Bolaji is not available, can I please have Ms. Zainab Kumar? Ms. Zainab, could you please unmute and ask your question? Okay, if Ms. Zainab is not available, can I have Mr. Baba Ibrahim Zarma ask his question?
Assalamu alaikum.
Wa alaikum assalam.
Thank you for the opportunity, and alhamdulillah, thank you very much, doctor, for the explicit explanation and details information. My own concern here is that since motivation is key to rehabilitation or intervention in cases of substance abuse, so what does it entail? What does it take for one to
We can't hear you. What does it take for one to do what, sir?
The issue of motivation is part of the key to the rehabilitation of individual with substance skills. So my own concern is that how to motivate an individual to become motivated in cases of.
Okay, that's fine. Question taken. Before doctor responds to that, can I also have Mr. Mahmoud Isa ask his question?
To engage in rehabilitation, friends and then people around us. Thank you very much.
Thank you, sir. Because we're running out of time, your question is noted. Thank you, sir. Your question is noted. We're running out of time, so we need to run. Can I have Mr. Abdulrazak Abiola also ask his question?
Thank you very much. Mine is related to gambling addiction. There is a case of someone that used the school fees given to him to play gamble, and they've tried to help him over and over and over again. As a matter of fact, the parents have gone to the extent of removing him, deferring his admission. I mean, for now, all his accounts have been frozen. So that he doesn't have money to do that. So, but it hasn't really helped. So I just wanted to know, in that kind of scenario, the boy is 20, a small boy, a university student. So what can be done? What approach do you recommend would be much effective to really get this boy out and for him to be able to continue his life, schooling and what have you?
Okay, thank you so much for that question. Can I have Ms. Zainab Umar ask a question? Also to say that if you've already asked your question or somebody has asked the question you had in mind, please put down your hand so we can probably better manage this. So, Ms. Zainab, ask your question now.
Assalamu alaikum. Good morning. Thank you for the opportunity. I really enjoyed what the doctor said, but recently I came across something called grooming with my neighbor. And I don't know if doctor can explain more about chromium because these are hydrocarbons in which children can get at home. Yes, please. I don't know if Dr. Tajudeen knew about it because we just found ourselves normally inhale these hydrocarbons, like nail polish and the rest. So I don't know if he can help us more advocate so that we parents can know what is going on because these are things, products such as nail polish, metallic paint, permanent marker that children have accessibility to get it at home, and it has something to I don't know. I just don't even know what to say.
Question gotten, Ms. Zainab. Thank you so
More
much.
awareness.
Miss Kende,
Yes.
Can I
or
speak now?
Mr. Kende,
Can I
can
ask
you
a
please
question now?
mute your microphone? Yes, you can, doctor, but I'd like Mr. Kende to please mute his microphone. There's some distracting noise from his end. All right, thank you so much. Doctor, please go ahead now.
Thank you so much. Sorry I was unable to unmute before. So first I want to appreciate Sakina and Dr. Tajudeen for this topic. May Allah preserve all of us in goodness. I want to look at this from the perspective of prevention, the relevance of the community in preventing this menace. When you look at it, what we're discussing is actually the tip of the iceberg. This is an epidemic engulfing our community. So I want to ask, what I mean, when you look at prevention, even the stigmatization we've been talking about all these, I'm of the opinion that the engaging the community relevant stakeholders in abating or preventing this either way would be of utmost utility. Now, the first question I want to ask is, what's the utility of involving the religious leader? You know, in the country Africa, we are highly religious. They tend to have our remotes. What's the utility of using the religious leader in combating or preventing this menace? What's the utility of the schools? I mean, most of these are gotten from peers in schools and the rest. The schools, the community, the spiritual leader, and government policy. I know there are a lot of policies, especially involving prescription and dispensation of drug of abuse. But from what the last speaker said, is even beyond the prescription drug now. There are so many substances out there being abused. Most, if I say most, if you permit me, are actually not prescribed. There are things you come by day to day, and they are freely available. So how do we intend, or what's the utility of strengthening government policy in this? So I think those are my questions, and thank you again for the opportunity.
Thank you so much for your questions and to other persons who have asked questions. I can see that we have more hands up, but unfortunately we cannot accommodate more questions. And while I had said multiple times that this is the last health talk we're having for this year, rest assured that we have so many exciting things planned for next year. So please follow our social media platforms if you're not already doing so. We'll put all the information out there so you can join our next series starting next year, inshallah. So please make sure you're following us on our social media platform, and you can get the opportunities, to ask as many questions as possible. Dr. Tajudeen, please go ahead to respond to the questions.
Thank you very much for all the questions asked. They seems to have really gone around all the areas that have been covered in the session that we have had. But however, to lay emphasis on it, when you say that, what does motivation entails in getting someone to treatment? And I've tried to talk about that. Motivation for us is not about yes or no. Motivation is about knowing what stage is an individual in with respect to this substance use disorder or behavioral use disorder that the person is having. And it is based on the stage that certain things should be done to help the individual to move to that next stage so that you can help the individual to get to treatment. So if it's skills that people are looking for, it's not something I would tell you just to do A, B, or C. It's a thing that needs training too. There are trainings that can be done to family members who have individual with this problem, that they will not use that skills to be able to help the individual who's a family, that family member with the problem, so that they will find it easier and be welcoming to the idea that I should go for treatment and have the treatment. So that entails some other more comprehensive training for people to be able to do that. But if I may just put it like this, based on that popular poetry, they say, roll, roll, roll your boat, gentle on the sea. Merrily, merrily, but life is what it is. But the most important is to roll gently. Because if you are trying to force it that people should change, it's usually challenging. It usually backfires. So our ability to roll gently with those people that will able us to be able to navigate that turbulent sea of addiction, because people are already in that sea of addiction when they are using that substance or they are engaging with those behavioral things. So you have to help them roll on that tiny boat they are clinging onto, not to get drowned. You have to help them roll it safely so that they can get to the shore safely. So you have to help them to do that, and that means it needs a lot of patience from you. It also needs a lot of learning that the person needs to do who wants to help somebody else who's going through that process. That's briefly about motivation. The same thing is also tied to the issue of rehabilitation, because to rehabilitate somebody, you have to get the person to the treatment center. But like I said, there are many, many places they call rehabilitation center, which are just torture centers. So I would encourage you to take people there. I've mentioned where I felt that there are standard rehabilitation going on there. So when you go to such places, that will be of great help. I know all teaching hospitals, they have department of mental health, and they offer one form of treatment for people who have drug or behavioral problems. They offer it there. And they stand alone major psychiatric hospitals across all these 6 geopolitical zones are also and they have all this present there too. So, well, with the skills that we need to motivate people, that will also help them to get to rehabilitation, so that will make them stay and get treatment and get off it. The question on the student with the gambling addiction, that the youth with gambling addiction is just like drug addiction too. Only that in this situation, people may look at it that, oh, I'm not using any substance. Why should people be worried about me? But the same process go through the brain. The same brain changes are also noticed in people that are gambling. And it's so destructive that everything that drug abuse do, that's also what drug abuse does. That's also what gambling and other behavior do to people too. So to help this individual, that kind of person needs that rehabilitation. He needs that treatment. He needs inpatient treatment. So advising and encouraging the parents to bring such individual to a standard evidence-based treatment center will help these people to be able to deal with such issues. People might think that it's gambling, they don't treat it there, it's not drugs. No, it's a disease process, it's a medical disease, and when they come, they will get treatment there. That is possible to be able to help the individual. But of course, they have taken some measures, but it's become more difficult because the person still needs to go through treatment to get over that. Then the question on chroming, of course, many new experimentation keep going on, and usually, but it's not that far from what we are used to. It's just one of those that we call inhalational use of substance, of psychoactive substance, where the main weight is that people just sniff it or breathe it in, or that's either through the mouth or through the nose. They do that in order to get high, and they usually use what is it, hydrocarbons, that which is based on their chemistry, the hydrocarbons. Usually, those that were usually get from the crude oil, those products from crude oil, which are mainly hydrocarbons. So products of such crude oil like paints, like some of the other dishes that were designed, like what they call the patching. That's what the organizer use. That they call it solution. which is just what they use for patching a busted tire. So all those things they use. So they find many ways to inhale it, and that is the chroming. And by inhaling it, because it will leave a metallic residue on the face of the person, because usually those people may pour it or put it in a cloth, an handkerchief, and you see them holding it and taking it close to their nose or wrapping it on their face. It's apart from that, some also use petrol because they are also hydrocarbons. Some may use kerosenes, and also the pit latrine is also based on similar phenomenon, that the people will wake up very early or go to a densely thick, pungent, waterlogged dump that fizzes everything. So the reaction of all those chemicals, so the hydrocarbons that are coming out from it, that they keep, so they keep inhaling it that way. So all this comes together, but it's just telling us that it's still an addiction. And it's just that the root of use is just that they are inhaling it. They are not swallowing it. They are not injecting it. That's just what it is, that they are inhaling it. And it's one of the it's the fastest route to getting addicted. Because anything that people can inhale, it gets faster to the brain than what people ingest. And that's why people can get addicted to it faster. And they can be very difficult to treat because of that fast rate route of getting to the brain. So because of that, this kind of people, to when they can be helped, but they need to come to a standard evidence-based. I keep evidence-based treatment center, because I won't encourage that just take to a rehabilitation center. No, evidence-based, because when you take to a wrong place, many wrong things can happen. And instead of helping, they end up harming more, causing more harm and causing more trouble. And about when it comes to addiction prevention programs, what can be done? There are many evidence-based addiction prevention programs that exist, but all this needs training. It's not the challenge now is that in the past, people just believe that when you just say, just go and talk to people to say, no, stop using drugs. It doesn't work, because to tell people to stop, it takes a lot more. It takes a lot, because the person using, it's not that he's just using that. Some people have also told him many other things. Like I said, many myths have been gathered, and the person believes those myths. So if you need to do an education program to help the person using to get over this, then you also need to be trained. You also need to get enough support, enough base capacity to be able to do that. I know there are some organizations that do addiction prevention workshops, programs, and things like that. We can liaise with those so that can be done. Of course, we do that. The Green Crescent Health Development Initiative, Iman does that. Many other people do that. But we need to be sure that the people who are approaching actually are using every day. They're not just charlatans who have made big banners, names, and things like that. That they are actually evidence to get this. Because without that, instead of achieving prevention, we end up enrolling more people into it.
Exactly. And doctor, just to corroborate what you just said now, on social media there is an experiment. When you post multiple pictures and you're telling people don't go to the last one, that is exactly what people want to check, because they want to see what is in the last slide. So just telling people say no to drugs, don't take drugs, really they don't work. And also to mention that I know that UNODC, that is the United Nations Office on Drugs and Crime, they have an evidence-based drug prevention program known as Unplugged. So for the teachers on this platform, or educators on this platform, or advocates on this platform, you can go and check up that and see maybe how you could sort of incorporate that particular initiative into your advocacy programs. Because like Doctor said, it's not just enough to say don't do drugs. So Doctor, we're running out of time, and I really want to thank you for your time, perspective, for sharing so generously. But before that, I'd like to quickly just ask you one last question. There's somebody in the chat saying, I have a family member suffering from addiction and depression. Please, can you recommend a good facility for this person? I'm asking this because you've been big on evidence-based facility centers, not the the Jekeru ones that would say we are doing this and they don't know what they're doing. So can you please recommend for this person?
No, I've said that along the line that any federal government-owned teaching hospitals or standalone tertiary psychiatric centers, then where you have the specialists there, then you are going to get what you need there. And there are teaching hospitals across the nation. The Federal Medical Center with departments of mental health or psychiatry, and they do this. So you get them. Of course, some might not have a rehabilitation ward, so they might, but when you go there, they will give you the right place to go to so that you can access them. Of course, where I work, we have, but that's in the University of Ilorin Teaching Hospital. So it's also a place that if people feel that it's closer to them, but instead of going around, no, I'm sure there will be one closer to you, wherever you are, and you'll be able to access that. And like you said, thank you so much. But like one of the questions that I've not addressed is to involve religious leaders and school. All that to involve them means they need to build their capacity. If they are open to capacity building, there are people that can do it for them. And like the Unplug program, yes, it's very good. But people, after reading it, they also need training. So that there will be, because there's the challenge with those things that people may just can just pick this and use, but what is the right interpretation of those things? What is the right meaning of that? What is the science behind what is said that you should do? So that when there are obstacles to achieving the desired goal, then you'll be able to know, okay, this is what I need to do, or do I need to refer to somebody else and move forward? So I quite agree, and thank you so much for inviting me to give this
Thank
talk.
you so much, sir. Don't go yet. Don't go yet. We'll still thank you specially, and our distinguished chairman will do that for us. But before I call on our chairman to do the vote of thanks and give the closing remarks, I just want to say that there's a Google link form in the chat. So if you have questions that have not been addressed, please drop your questions in the Google link, and we'll try as much as possible to get back to you on the response. And like I've been saying over and over, what this is the last for the series this year. We're going to be having so many series next year. So please follow us on social media if you're not already doing that. And importantly, you already know that we do a great work at Sakina Medical Outreach, and these things do not come cheaply, they're expensive. So help us do our work better. Please donate to our cause. The link to donate is also in the chat. If you cannot donate directly, make sure to copy the link and put it on your WhatsApp status. Share it to groups that you belong to. Encourage as many people as possible to support the fantastic work that we're doing at Sakina Medical Outreach. You can also check our website at sakinaaoutreach.org. Again, our website is sakinaaoutreach.org. We're going to put it in the chat feature as well. You know, just connect with us in many ways possible. Let's see how we can work together, how we can collaborate to ensure that substance abuse is a thing of the past, and we have young people who are willing to be resourceful and contribute meaningfully to themselves and the society at large. So right about now, I'm going to be calling on our chairman for the vote of thanks and the closing remarks. You know, his leadership has been pivotal to the fantastic and incredible work we've been doing at Sakina Medical Outreach. And we just want to say thank you to you, sir, for a delectable leadership. And he's going to be doing the vote of thanks for us and encouraging us as well to be a part of the movement. Join the Sakina Medical Outreach. Let's see how we can collaborate together and move this country forward positively. Over to you, sir.
Oh, Jazakallah Khaira. Rafia, thank you for the beautiful work you have done and you are still doing. Special thanks to our guest lecturer, speaker, Dr. Tajudeen Abiola. And we thank you for your time, for your knowledge sharing, and we really appreciate you. And we hope when we call on you next time, you will answer us. And for all the participants, thank you very much for your participation. And as Sophia have said, Sekino Medical Outreach is involved in educational program like this one. And we also do interventions for indigent member of the society. We take care of their medical care. And just to give us an hint, in February next year, inshallah, we will be having surgical intervention in Abuja that focus on complex urological cases. We are partnered with medics across continent, the UK, charity organization. We'll be doing more than 100 surgical procedure in National Hospital Abuja, inshallah. And these procedures are to be free. So we'll seek your support in making it a success. And if you have any patient that can benefit, you can also let us know. We will give more information on our social media platforms so that as many people as needs the service can benefit from that. And as many of us that can donate to that cause, you'll be welcome. And you can also be a volunteer to Sekina Medical Outreach. It's run purely on volunteerism. We have youth volunteer platform. We have other adult and professional volunteers. We can all be part of this. Inshallah. Jazakallah khairan. Assalamu
Amina.
alaikum warahmatullahi.
Thank you so much, Mr. Chairman. Thank you, Dr. Tajudeen. Thank you, everyone. Speaking of Abuja, when you talk to Abuja
Thank you.
next year, inshallah, I will be there physically because I'm in Abuja. Thank you, everyone. Enjoy the rest of your Saturday. Bye.
Jazakumullah khairan. Thank you very much. Bye-bye.
Thank you very much.
Yes, sir. Ẹ ṣeun. Ẹ káàárọ̀. Ẹ káàárọ̀. Ẹ ṣe wà á dúpẹ́. Ọ̀sán mọ́tò ẹ̀ṣẹ̀ jẹ́ òwá bí lónìí.